Will pelvic floor exercises help rectal prolapse? That's the subject of this video. Stay tuned. Hey, this is Dr. Shakib from Core Pelvic Floor Therapy right here in Irvine, Orange County. While in my practice, I don't necessarily see patients with rectal prolapse. I don't treat them for that. I see a lot of patients that have pelvic floor dysfunction issues, and some of them do have rectal prolapse. So the question is, will exercises help rectal prolapse? So the word exercise is quite extensive, it's quite broad. When we're talking about proper breathing, the biological breathing, which I'm going to make sure we put at the end of this video from a different channel I have that is fully based on posture and movement. That's where I discuss that subject. We're going to make sure we put it on this one. You will notice that biological breathing, the way babies breathe, is an exercise. So that is going to be helpful for everyone with every issues related to movement, or in this case, incontinence, prolapse, whatever the case may be, pelvic floor dysfunction as a category. It will assure that the level of pressure on your pelvic floor, which is the inside of your pelvis, the inner lining of your pelvis, and it's not just your anus, penis, or vagina, or perineum, which is the tissue in between. It's a lot deeper. It's the whole inner lining. Just an example, piriformis muscle, the muscle that does external rotation of your hip, obturator muscle, which assists in that, are parts of your pelvic floor. So that may come as a surprise to you. So the exercises that will assist you in better positioning of your pelvis and better connection of the structures attached to your pelvis, which are primarily your lumbar, your lower back, the hips, the sacroiliac joint, the pelvis joint, and in the back, the two of them, the connection in the front forming your pubic bone. All of those are huge players that people don't think about when they think about rectal prolapse, rectal incontinence, any kind of incontinence, or any kind of pelvic floor issues. And that's the reason why we're not really making a good success long-term with pelvic floor dysfunction. So to answer the question, I have to say it all depends. It depends on the level of prolapse. It depends on other comorbidities, other things that may exist along with the weak or prolapsed rectal tissue. And so depending on that, the type of exercises can vary. Most of the times when people have rectal prolapse, it's just excess pressure or trauma of a kind. So sometimes surgery is the only answer. Even in those cases, after surgery, what you do is crucial, because you can rehabilitate in the area properly, or you will have this problem as a different form down the road. I hope that this helped you better understand the degree and the level of complications and complexity in this example, and do know that exercises do make a difference. And if you have any questions, make sure you contact one of the methods of contact in the description box to contact me. If you have not subscribed to the channel, this is your opportunity to do so. Thanks for watching. Take care.